We have two issues. That's fine if you all. That's fine if you all. If you can reorganize it such a way, just let me know. Oh, I don't know. I think. I don't know that we can do that.
Madam Chair, can I just quickly just give some summary comments for today, because I'm going to go really fast. So I appreciate it. I'm sorry just to quickly take some time away from the speaker, and I will watch this on video because I want to hear everything that you all have to say, but I just want to just summarize a lot of what I've heard today, and I want to just make sure that you understand where I'm coming from, is that in my view, the patients are going to come first. No matter how we go through the process, the patients have to come first, and we have to make sure they're taken care of. And one thing I've heard in our hearings is that we need the appropriate time for any kind of transition plan, and that I am certainly open to any kind of new modeling in making sure that we take care of these more severely developmentally disabled people. And also a very strong advocate that the savings that we realize through any programs that we undertake, I think those savings need to go back into the developmental services apparatus of the state. There's no question that there's a significant hit with respect to federal funding to the tune of $44 to $50 million, which is very significant. I've had invitations to come visit the DCs, and I spoke in 638, SB 638 and 639, and I would look forward to coming to the developmental centers. I appreciate all the information on the 962 homes and look forward to working with all communities to ensure that this infrastructure is in place so that if and when we do dismantle these facilities, that we have an appropriate place for people to go. And I also appreciate Supervisor Gorman's comments here today, and certainly Senator McGuire. I look forward to working with him, and also the senator from Orange County, Mr. Morlock, who was just elected, my colleague, because we have one of these facilities in his district. And I also appreciated the comments of Ms. Aronor, a former assemblywoman who has a strong historical memory of how things have transpired in the state with regard to the Landerman Act. And she laid out, I think, a very appropriate plan assessment of existing plans, a plan of action. She made the parallel that consumers in the developmental centers that we're talking about are similar to those that we have seen in the recent closures. She also brought up the timelines, very important to move on timelines, and certainly the cost to move these people, which can be very expensive, as we're learning through the Landerman process. And she even suggested the utilization of a trailer bill so that we can get the process started. That's something that certainly my colleagues can discuss, something that I would be very supportive of. So I look forward to a comprehensive solution and working with my very esteemed colleagues and taking care of some people that need more attention than probably any other population in the state of California. And I look forward to partnering with you.
Thank you, sir. Appreciate it. We're going to take let Senator Monning add on to 2 additional actions, and then we'll go right back to public comment. Issue number 4, Landerman Development Center workers' compensation costs. It's on page 17 of the agenda, which is the $17.3 million, $9.1 million general fund to pursue settlement of open workers' compensation claims.
Aye.
Okay, that's out 3-0. Issue 5, the baseline adjustments, page 17 again, and that is to Approve.
Aye.
That's out 3-0 as well. Thank you for allowing me to manage that housekeeping while I still had all of my members of the subcommittee. We'll go back to general public comment on items 1 through 13. Thank you. 2 minutes.
Hi. My name is Beth Hadley. I'm a retired and also a substitute special ed teacher. I work for Sonoma County Office of Education. I've worked for over 35 years with individuals with very severe disabilities at 3 different state hospitals and also in the community. And I can tell you that there are unique services at the Developmental Center in Sonoma that are not available in the community where we are. And I believe that the developmental center could be financially viable if these services, such as custom-made wheelchairs, custom shoes, dentists who know how to work with these kind of patients, and more, were available on an outpatient basis. Also, the cost could be brought down if admissions were reopened. I am not against community homes. I know many people are very successful in them. I was hired 35 years ago to transition people in the developmental centers into the community homes. I think after 35 years of doing that, what we have left there are the most severely disabled, medically fragile, and/or people with behavioral problems, and I don't believe that their needs can be met in the community. And And when someone is inappropriately placed, the consequences can be dire, as we know. One of the reasons I feel so strongly about this is one of my own students was placed in a community home over our objections as a result of the Kofelt suit, and he died within a year. And his community home never contacted us to consult with us about his problems, even though we offered to talk to them anytime. The only way we found out he was in the hospital is we called to see how he was doing. He died away from the people who had loved him and cared for him all his life, and it was totally unnecessary. And a recent report says that 19% of the SDC clients will die if placed in the community. This beautiful property has belonged to the people of California for over 100 years. It should be preserved to continue to serve some of our most vulnerable citizens and expanded. It could serve the mentally ill, it could house the homeless, it could provide internships for college students and more. So we have a coalition working in Sonoma on these issues. They have Transform Sonoma. Instead of closing it, why don't we try transforming it, using the property we have and the buildings we have to provide these needed services instead of spending millions to build new homes someplace else? I implore you to think creatively and not let our developmental center be sold off to the highest bidder under your watch.
Thank you very much. Appreciate your testimony and your patience. I'm going to ask everyone to try to stay within 2 minutes, please. Thank you.
My name is Beverly Austin. My daughter's a resident of Sonoma. My main issue at this point is that there are some services at Sonoma that don't seem to be available in the community. In particular, my daughter needs a special wheelchair, and it's made at Sonoma. It has to be redesigned every few years because she has severe cerebral palsy and it keeps changing her body. And we have not found a place, the regional center has not, and that does that kind of work. And so those services, as well as there's special dental services up there. I've been in court and heard instances of people who have not been able to get dental services in the community who have moved from the developmental center, even though they're supposed to be in place before they're moved. And so that's an issue. I think it would be good to try to look at the task force report that was developed and follow some of those guidelines. I'm not hearing any of that being mentioned here. And I think it's important because otherwise my daughter will go out and not have some of the services that she actually needs to keep functioning. And I think I'll let it go at that. Thank you.
Thank you very much.
Hello there. My name is Tim. My last name is Glover. And I work for a program called STEP, S-T-E-P. I've been with them for many years now. And I I joined STEP, and I have friends that are there. And this is my friend that I want to show you that's there. And my friend's name is Casey, and her last name, well, we just call her Casey. That's my friend from STEP.
Thank you.
Hi, my name is Janine, Janine, Janine. Yep. And I have diabetes. And I have a job. I work at Pride. And I only get a little bit of money. Why is that? And I work really hard at Pride. And why? We need more money. And that's it.
Thank you.
Hold on real fast. Sorry. Hi, my name's Carl. My last name is Poland. So I grew up and I was abused by my parents. My life was really messed up. I got in trouble, had some serious issues, and then I got placed in a hospital. That hospital was awful. I went in and there was nothing there. Nobody communicated with me. Everybody was hearing. There was no deaf. I had no community access at all. I was stuck there for 3 years, just isolated, suffering, just staying there. Then finally I got out. And I arrived at STEP. I've been with STEP for 5 years. I have a job. I am a janitor, and I'm proud of my work. I do landscaping. I've had a variety of jobs. I'm successful. Look at me now. Look at who I am. I've improved. My life is great. You know, when you compare to other people, they can do the same thing in the hospital. The hospital's awful compared to the community. You know, I have relationships, and I'm doing so much better here. Finally, in the community, I'm out, I have neighbors, you know, I have friends, anything I want in general. Thank you. Have a good day.
Thank you.
Hello. My name is Alex, and my last name is Nero. And I have a job, and I work at Pride as well, and I'm disappointed because I don't make much money. I want to make more for the hard work that I do. I work hard all day, I stay focused, and I keep myself very busy, and I attend work all the time. I don't want to be in a center to be a patient that's there all day. I want to be out. I want to be able to exercise. I want to be able to work, and I want to be able to continue employment, but I want to make sure that my wages go up. I need to make more money for the type of work that I do. The tad bits, the pennies that I get on the dollar is not okay for the amount of time I put into my job. Thank you.
Thank you.
Hi, my name's Christine, and I work for STEP Strategies to Empower People. I'm our quality assurance manager there. And I just wanted to give you guys this picture. This is Melissa. She's one of my dear friends. Melissa is developmentally delayed. She also has severe cerebral palsy. She lives independently in her own home. She's a mother, and she is a grandmother. She's also deaf. She works. She's an amazing artist. And she also has a custom-made wheelchair that I actually helped facilitate getting that meets her specific body needs due to her decline from the CP. So thank you.
Thank you.
Hi, my name's Samantha. I also work at STEP. This is my friend Mia. She has Down syndrome and an intellectual disability, and she has a job, and she has her own home and is thriving in this community.
Thank you.
Hello there. My name is Michelle. Hi there. My name is Michelle again. I just wanted to tell you that I have a wonderful, wonderful relationship with this individual here. Noel, he is diabetic. He works for STEP. He has worked there for a very long time. He works janitorial services, cleaning. He makes his own choices. He's an independent individual. I can't even imagine him being in a hospital. He would have no independence, being able to choose what he wants in life. He'd be locked up. Now he's here and he's alive. He's living his life. living in the community. Thank you. I want to give these to them.
Sergeant will come take them. Thank you.
Hi, my name's Nanette Hansen, and I'm here to speak on behalf of my brother John, who has been a resident of SDC for about 25 years now. He's severely autistic and retarded and is nonverbal. He has thrived at SDC. He's received nothing but excellent, comprehensive, caring care and support there. And one of the key things that it is that the staff are trained. The medical professionals that are there are familiar with working with people with these disabilities. And I support it staying open or being transformed is the bottom line. My concern with the community setting is that my brother was put in he had 2 instances of being in a community home several years ago. Mm-hmm. And the first one, one of the staff pushed him down a flight of stairs, and he fractured his leg. He was in the hospital for months, and he's still suffering from that with severe arthritis. And also in the second home he was in, a psychiatrist that was unfamiliar with him and his medical needs and conditions put him on medications that were severely detrimental to him, and he almost died with those. Since he's been at Sonoma, he has been in excellent care, and I support that. And I also support that any kind of funding is that you must pay the staff that work with them adequately, because what they do is tremendously important, and they're keeping our family members alive. And I also invite you to come to the facility anytime.
I've been there. Thank you.
Okay, thank you.
Next witness, please. 2 minutes.
Madam Chair and Senators, my name is Grant Gibson, and I'm here representing my brother Stephen. He's been a resident at Sonoma Development Center since 1970. He's 57 years old, and I don't really think of Sonoma as an institution, and a lot of people may have a different opinion of that. For him, it is his least restrictive environment. It's his home, and it's been his home since 1970. It's pretty clear to me, just listening to a lot of the discussion, and I think what you're going to find, I'm going to actually kind of make a prediction. It's clear that I think you're going to find that we need 2 types of facilities when we get through some of this process. It sounds like we've had a robust assessment of the remaining residents in the developmental centers. And here again, I think it's great. Everybody's happy when some of the men and women that are here today that have transitioned into the community. What a tremendous success story. But I think what you're going to find, we're getting down to the few, and I know it sounds like a small number, but these are the guys that and girls or men and women that just aren't going to be able to make this transition. And I know there's a lot of discussion about existing facilities and proposed facilities that are going to try to accommodate them. But I think we're just going to find that maybe we're going to have to kind of reinvent or whatever. I think you were looking for some words earlier, Madam Chair, that I know I'll ask for some help, but reinvent Sonoma. And maybe I don't know, it's more than 4 beds and it's less than 400 maybe, but that's the direction I think you're going to find that you go in once you do this analysis of some of the remaining residents. So thank you very much.
Okay, I'll be short. I want to thank you all for the opportunity to talk today. My name is Catherine McCoy, and I'm with San Andreas Regional Center and also SEIU Developmental Disabilities Council. I'm a service coordinator at San Andreas, and I helped with the Ag News closure. So I have 100 cases on my caseload, and of that, I have 60 of those folks that came from Ag News Developmental Center and Lanterman. And I also oversee 11 of the facilities that were, made through the closure process. And it was a beautiful thing. I mean, and like everyone's saying, and I think we have the roadmap. We kind of know what to do. It's all person-centered. If we focus on that and focus on building the infrastructure first, we're going to get it right. But we can't forget the fact that the health and safety of the folks at the developmental centers also have to be looked at. So I want to support that we look at those issues and fund that immediately if we can. That's really important. Also, in terms of the rates, I think it's very important that we do look at the rates, because the community state staff program works beautifully when it works, but then the community, we really do need to build up those rates. And I know that the work of the Delivery Service Task Force is looking at that right now, so hopefully we'll be able to come up with some good solutions. But ARCA's comments were very on point. So thank you so much for your time.
Madam Chair and panel, thank you so much for hearing us today. I'm just going to read off my phone. It'll be much quicker if I do that. I'm grateful to hear you say people come first. For now, can we agree to set aside the people with families that want them to stay? Let them figure out what their needs are. Can we then agree to allow the people that want to leave to leave? In the last few years, I've met dozens of families that have had to fight to get their loved ones out. I've been to many DCs to assist movers, and at each visit, I meet patients that beg me in the hallway to get them out. The answer? I was asked last night directly, how does a person get out? And the answer is, the family will have to fight, or a social worker will have to believe. Without that, they don't have a chance.
Hi, my name is Tiffany Eggman, and I work for STEP. This is my friend Wong. Wong, before she was set free, she lived a life of isolation and sexual abuse. She is deaf, but she has now learned to sign. She now has a great group of friends and now understands what healthy relationships really are. But most importantly, she is now free and she is no longer afraid.
Greg DeGier with the Arc and United Cerebral Palsy. First, we support the almost unanimous recommendation of the DC task force last year, which diplomatically avoided the use of the word closure and talked about transition. We're okay with that. As we're looking at a transition from these big facilities, big institutions to the community, we've heard people who I'm sure sincerely believe that things are just fine at the DCs, that all the problems of just a few years ago have all been fixed. Well, in the last 2 years, the Department of Public Health has issued 23 citations, serious citations to Sonoma. I did not look at any other institution. These included sexual abuse, client sexually abused by her designated staff, and it did note that the rape or the assault was reported to police, and they did arrest her. They did arrest the staff member who did it, so there has been some improvement in law enforcement. Neglect. 2 clients found in urine-soaked beds, hadn't been checked or had diapers changed all night. Delayed reporting of suspected neglect, 42 days. And there's no note that they were any of the staff members who failed to report were ever arrested. And 2 deaths due to negligence. One of them, medication. Client received 4 times recommended dose of the wrong medication and died as a result. And I'd like to close with 3 sentences from Julia Bascom with the Autistic Self-Advocacy Network, who says it better than I've ever been able to. We have over a century of evidence telling us that all institutions, no matter how beautiful, no matter how carefully designed, no matter how well-intentioned, and I would add no matter how much money we throw at them, fail every time. Anytime you take one group of people, force them together because they share a stigmatized characteristic, isolate them from the broader community, and exercise control over their lives, who they can see, what choices they can make, what and when they will eat, who they can socialize with, where they will live, it's inherently a bad thing. The problem is that they are segregated and deprived of choice, control, and community. The problem is the setting.
2 minutes, I got it. My name is Kevin, I promise. My name is Kevin Rath. I'm from Manos Home Care. We take care of 1,200 clients with disabilities in their own homes with their families in the East Bay. And I've never heard a family say, I want my child to grow up and be in an institution like a DC center. I would like to address the issue that's been suggested, or the dream that somehow we can reform these institutions and that could somehow be cost effective. The reason we can do what we do at $8,000 a client per year instead of $500 is because we leverage community resources. An institution isolated like that can never leverage community resources. So by definition, it will always be extremely expensive. Thank you very much.
Next witness, please.
Hello, my name is Jamie. My last name is Christopher. And I was in a group home before, and I've been in hospitals before as well. Now I'm in STEP. I have a job. My life has significantly improved. My medications have gone down. I don't need to be on as many. And I have a lot of money. I'm able to pay my own bills. And, you know, I've got less staff care needed who operate independently. And so my life is much better being a STEP client.
Hi, this is Joanne. Oh, sorry. Hi, this is Johanna. She's deaf and blind with congenital rubella syndrome and with a dual diagnosis. She lives in her own apartment and has a job, and she's been successfully living in the community for 25 years with the help of STEP assisting her, and that's it. 10%.
Hi, I'm Wilson.
Next witness.
Will Sanford with Futures Explored. I wanted to come to an agreement with Catherine Blakemore, who said I think best is we are all one. We did a legislative town hall meeting earlier this year where the theme was we are you. And it basically showed our folks being a part of our community, doing the things that all of us do every day. So I think that's an important thing to remember. The other one is a community. We've invested a lot in developmental centers to try and fix them. At the same time, we have folks who would like to have jobs, and we haven't fixed employment in the community at a significantly lower cost than that. So if we invest in both sides of the equation, I'm probably okay with it. If we invest only in one side, a little more of a problem. The other one is we do have the task force recommendations. I was a member of that. There was a roadmap to go out there and do it. And I think at some point we need the closure plans to be announced. Dates, it'll get done when people get done, and the facilities and programs are there to support people. Thank you.
Thank you. And final witness.
I'm hoping you'll let me speak for myself and 3 of my friends.
All within 2 minutes, absolutely.
My name is Lydia Edinburgh. After 13 years at Napa State Hospital, my son Olaf, who was born with congenital rubella syndrome, is deaf-blind, has aortic stenosis, and is developmentally disabled. With support from STEP, is living successfully in the community. He works, has great job ethics, lives in a home of his own choosing, decides what he wants to do each day. Yes, there have been hiccups along the way, but what is life without hiccups? Without the hiccups, what do we learn? Olaf enjoys his life in the community. My friend Libby was here today, but she had to leave. She had me write out her speech from her communicator. Dear Senator Mitchell and other senators in attendance, my name is Elizabeth Drake. I am an employer advocate for the agency called STEP, Strategies to Empower People. I have cerebral palsy. However, I am here before you as an independent woman working and living in the community. I am here today to tell you how good it feels to live on my own, in my own home, and have a job. I have staff that support my goals and provide my personal care. According to Health and Human Services, there are approximately 1,484 individuals still living in 4 developmental centers throughout California. Out of those individuals, 39% of them have cerebral palsy. That is a total of 579 individuals not living a full life. I am just one out of many living in a community where it is needed. Why keep spending millions of dollars for someone in the DC when you can invest that money in the community? It costs less for that individual to live in the community and thrive. I urge you to make the right decision and remember me when you vote. The time is now. Thank you for your time. And then my other 2 friends. This is Laura. Laura has congenital rubella syndrome and diabetes and is insulin dependent. and she also has cerebral palsy. She says, I live in my own place in the community successfully. And this is Alan. Alan also has cerebral palsy, complex behavioral needs, but can throw he says, you can throw all the labels you want at me, because no matter what I will always choose my own home and my own choices. Thank you for your time.
Powerful words to end public comment on. Thank you very much to everyone who hung in here, allowed us to take a break to do some of our administrative work. We appreciate you. I think I announced with each item what we would be holding open until May revise, right? Yes. We're going to move on. I'd like to thank the interpreters, American Sign Language interpreters. If you could ask, now that we've moved on from the DC agenda item, if there are people who will remain for the balance of the hearing who will require interpretation services. Yes. Just based on the agenda, I didn't know if they would be staying. It looks like no. Thank you very much. Appreciate you.